Uganda got an outbreak of Ebola last week in Mubende district, although government has not yet come out with guidelines to prevent the spread. School administrators say they have got information about this disease from parents who are medics, but expect government to come out soon and pronounce itself on the same.
We haven't got from the government, however, some well-wishers in form of parents were able to share some information which was that guiding and abiding.
The head teacher, Nakasero Primary School, Rogers Namboli, says they are ready to comply with the advice of technical people.
Also receiving support and instruction guidance from our superiors, KCCA, and which we believe that if well taken care of, it will help us to curb or control the would-be big effects.
Both administrators agree that they can borrow measures used in the prevention of COVID-19 and apply them in the Ebola situation.
SOPs during COVID-19 was washing hands, and really here you find that it is equally important. Another SOP was social distancing, and you will find it will apply here. Unnecessary handshaking was not allowed. Still the same will apply here. So
of COVID-19 and there are elements that can support, like cleanliness and avoiding a crowd and that kind of thing. So we are going to borrow from there and see how we can apply this other side as well. Only that it goes with a cost sometimes.
After receiving information on the Ebola outbreak, the schools embarked on sensitizing the learners.
Issues of sharing, there are things we don't share hankies, we don't share, we don't share stockings, we don't share shoes, because as you share the stockings, somebody can sweat, therefore you are sharing the fluid. So we have tried to sensitize them.
Sensitization of our learners and the staff, and which we have already embarked on. We also depend on our stakeholders, particularly the parents, their awareness.
Macquarie University Vice-Chancellor Barnabas Nawangwe explains the measures the university is putting in place to prevent the spread of Ebola.
People who are adults, they know what we are talking about. They are people who can read and they understand. So the best thing we can do and what we are doing is sensitize them and put in place measures so that we avoid unnecessary concentration of people in the same place.
KCCA released a statement about the outbreak and highlighted how Kampala was at high risk. It has put a task force to monitor the Ebola situation. I'm Nafka Farida and Dan Lugema.